to control our mind and to connect with our mind. Okay, can you take it out? Here, just make it sure you see. So welcome again. Namaste. So we are here today to represent, to showcase some mantra concept, mudra concept and pranayama concept in the Ayurvedic as well as yogic sciences. So let us see how we can connect and bring these dots together. So as we know, excuse me, as we know that our upper body part is dominated by the kapha, the middle body part is dominated by the pitta, and the bottom body part is dominated by the vata in the body. So here we are going to use the pranayama, which is breathing techniques. Pranayama, prana means vital breath. Ayam means exercise. So here in pranayama, we have a wonderful opportunity to consider, concentrate and focus on our breath. The breath in a very specific manner. We are going to create this specific manner breath so that we can get the utmost benefits for the different systems which we are considered here in addictions, in smoking, as we have disturbed the pranavahasrotas, which is the lung system or which is the respiratory system, and the raktavahasrotas, which is our circulatory system. Okay, so but before we go to the today's technique pranayama, we will revise our yesterday session. So let us revise our yesterday session, and I hope you understood the concept of doing the mudras in a proper way, right? So our first mudra was our namaste mudra. So in the namaste mudra, this is our namaste mudra. Our fingers are pointing up, our thumb is close to our heart, our elbows are nicely, they are not sloppy or drooping, so we are holding them upright position, in a proper position. So that way, this is the intention of doing the namaskara mudra, is like proper position and proper place when you are performing it. Okay, so namaste mudra. The second mudra what we learned yesterday was Chin Mudra. So in the Chin Mudra, what we did, we brought the first two fingers together, we made a nice circle, and we kept the hands close to our femoral area, our groin area, or our increase area. This is our Chin Mudra. And we explained all the benefits of all these mudras in our yesterday's live. Now the third mudra which we practiced after the Chin Mudra is, first you create a Chin Mudra and then you curl your rest of the fingers, and this is like this. So circle the first two fingers, index and the thumb coming together to form the circle, and then the rest, and we are placing at the same place. Okay, femoral area. Chinmay Mudra. You can sit, focus, again the way I explained you all the benefits, the proper ways of doing it, why we are doing it, everything is mentioned in yesterday's live. Okay. Now after the Chinmay Mudra comes the Adi Mudra. Okay. What do we do here? We bring the thumb at the base of our pinky finger, and then we curl all the fingers over the thumb. This is what it is, the Adi Mudra. Where do you focus? Where do you keep the location of the palm? How to do it? Again, go and watch yesterday's live. Okay. Now the last mudra what we practice is a Brahma Mudra. And here what we did in the last mudra is like we created the Adi Mudra first, and then we brought our knuckles together, and these knuckles we located them close to our navel, solar plexus. So this was our mudra session, mudra therapy, mudra, the healing art, on the subtle energy levels. Now, on the physical level in today's session, we are going to use another technique, but before we go into the technique of pranayama, what I would like you to do is like when you are in this Brahma Mudra, what I want you to do, inhale fully, and now when you are exhaling, you go slowly along with your breathe out. Along with your breathe out. See, my whole pressure. My hands are in a proper position at the solar plexus, and along with the breathe out, you are slowly coming up on the ground. So wherever your body allows you, along with the breathe out, if your breath is out here, wherever your breath is out, you stay there. Do not just let your body drop or reach. That is not the intention of doing this. Okay? Stay there for a few more. Breathe in and breathe out. And see, along with each breathe in and breathe out, if you can reach a little further. Now, slowly come up, one by one vertebrae. So if you have observed here, a nice pressure we created between our abdominal organs, our mudra, as well as our breath. So they all were getting connected in this one action of in and out, ushwas and nishwas. Okay? Now we are going to come to the pranayama technique, which is a pranayama, the Kapalabhati. Today's topic is Kapalabhati pranayama. So in the Kapalabhati pranayama, this pranayama is made up of two words. Okay, the name itself represents a meaning behind this. So Kapal means curl. Bhati means like pumping, Kapalabhati, right? You know, like when you're like pumping, right? You know, when we do the pumping in the cycle tube, you know. So that is a kind of like that. The same action we are going to use here through the breath, rapid action. Okay. So in the Kapalabhati, it's called it as a fire breath. So why it is called it as a fire breath? Because when you are practicing this specific asana, pranayama, your body is going to generate the heat. And this heat will travel from our body, from the core, and it will focus and reach to the skull. Okay? What are the things located here in the skull? Which vata we are talking here? Pranavayu.
Oh, prana. Yes.
Right? Out of the 5 vatas, the major vata which is located in this area is a pranavayu. So in addictions, in smoking, in alcoholism, in a substance abuse, in a food addictions, specific lifestyle addiction, right? Addictions can be good or addictions can be bad. There is a fine line, right? If I have a good addiction of eating good, that's a good addiction. If I have an addiction of eating bad, that's a bad addiction. But food is same. But my approach to that food is different. It's called it. So we have to see whether my addiction is good or whether my addiction is bad. It's better to have a good addiction, right? So we can create nice sanskaras or sangati. When we have bad addictions, then they hurt to the mind, they hurt to the body, and they hurt overall our way of living life, right? So we don't see the positive effects because we go down and down and down with our wrong addictions, wrong choices, right? It's not, smoking is a very one small consideration or one of the type of addiction, right? Eating burger or eating specific food can be an addiction. I have a habit of sleeping 3 hours in the afternoon. It's an addiction. I have many clients that they wake up in the morning and from 6 a.m. to 9 a.m. they are just lying down and they are watching TV. That is addiction, right? So I have many people who has the habit of living with the second wind in the body. Have you heard about this second wind concept? That means you stretch like 9:30 to 10 to yourself. When the real sleep is coming, you just pass that moment. You know, that moments. You pass it and then you will be awake for 3-4 more hours.
Night vigil.
Yes. So that created addictions. And all these are created by our mind. Not the physical body. The mind. But mind and body, they both goes together. Ashraya, ashravi bhav. They stay with each other. So whatever you are, so there is a deep relationship of food and there is a deep relationship of mind. Food equal to mind. Are you understanding what I'm saying? So whatever we feed to the physical body, the qualities of the food is going to also nourish to the mind. The subtle energy from the food is also going to travel to our mind. Manovahastratas. Okay? It is one of the system in the Ayurveda. You know, we have given very much importance to the mind. So whatever we are feeding to the physical body, the qualities of the food. Now we are coming back to the concept of the food as a medicine for the physical body, mental body, spiritual body, as well as emotional body. So whatever the qualities you are feeding to the physical body is nourishing to the mind. So you tell me until now what you nourish to the body is like frozen, canned, pocket, heavy, steaks, non-veg, what else? Packet food, dried food, lot of sugar, right? All of these, and That's the term you used. Everything, whatever you gave and offered to the physical body is also going to the mind. So if there is a less vitality, less energy, less prana in your food, don't you think that that is going here also? Right? So the qualities of the food is directly proportional to the quality of your mind. In Ayurveda, we have Triguna concept. The Trigun means three qualities of our mind. The Sattva, the Raja and the Tama. Sattva, Raja, Tama, depending upon what we offer it to the body, this quality changes. So you make sure you offer, if you offer a kind of food that can create the agitation in the body, right? The acidic food, the fermented food, right? This is like a process. There is specific process to create that kind of effect on the food, right? So that affects to the Raja in the mental aspect of our mind. If we offer the food which is like mixture of this and that, sausages, the food, canned food, right? That increases, that all is like a darkness in the food. And that is going to feed which quality?
The tamas.
Tamas quality in the of the mind, right? So, and if there is a full prana, if there is a nice alkaline combination, if there is a freshness in the food,
Sattva.
that is going to affect to which quality of the mind? Sattva, right? So these are the qualities of the food is equally proportional to the qualities of the mind. So when you are eating such kind of food and such kind of combinations of the food, that is going to
affect the mind.
Affect the mind. Understood? So here, whatever you learned in yesterday's session, the cooking class, the therapeutic cooking approach, and whatever we discussed throughout the day, you remember all of that and you stick to these concepts. Because when there is a lack of nutrients, lack of minerals, lack of nourishing factors to the physical body, then it is going to create the vacuum into the mental body also. Because something is lacking here through our food which we are not offering properly, which is supposed to be made up of the 5 elemental concept. Because what is the body? What is in Ayurveda we see this physical body is a replica of the nature. This physical body is made up of the 5 elements. And there are 5 elements outside, there are 5 elements inside. So macrocosm, microcosm, that's the basic connection. So the more you stick with the connection, the more healthy it will be. Understood? Okay. So in today's pranayama technique, if you understood all of these qualities of the food and the qualities of the mana, then it is very easy for you. If you follow first, this is the base. You need to follow this. Then only you can use the pranayama technique. You can use the yogic practices, or you can use all the modalities what I have taught you until now. Then only you will see the beautiful effects in your health and wellness and well-being approach. Okay? The health will not come in the body. Health is not the absence of the disease in Ayurveda. So health is a huge concept in Ayurveda. To have this beautiful health, to have this concept of health and well-being, not wellness. Many times I try to keep well-being concept in my post and in my teachings and in my all the whatever the awareness I like to create in. It's like it's a well-being approach. Wellness is a very devalued form of the well-being approach. Okay? So samadoshaha, samagnishcha, samadhatu, malakriyaha, prasanna atma, indriya, manaha, swastha iti abhidiyate. And I hope you understood the whole concept of this shloka. Right? Or do you need me to explain it one more time?
I think so.
You want me to explain it?
I know balanced doshas, balanced Agni, balanced mind, body, and
Sensory organs.
sensory organs.
So the balance in the dosha, the balance in the tissue level, which is the Saptadhatu tissue level concept in Ayurveda, the balance in the actions of the waste of the body. What are the waste of the body here? The waste is your bowel movement, your urination and your sweat. Mala, Mutra, Swed. These three concepts in Swed. Malava Srotas, Svedava Srotas and Mutrava Srotas. Okay? And then comes the happiness in your mind, happiness in your sensory organs and happiness in your body. And when we have an equilibrium in all of these aspects, then somewhere you will reach towards the concept of the health. But to manage all of this, you have to follow the Dinacharya, you have to follow the Rutucharya, you have to follow the Ratricharya, you have to follow the Sadvritta, which is the disciplined behavior throughout the day. Physical behavior, mental behavior, social behavior, environmental behavior. So we have to follow each and every aspect on the day-to-day basis, so that your doshas, your dushas, your agnis, all these things will come into place. Good? So let us do our today's session with a Kapalabhati Pranayam, where our intention, our focus is, as we are talking about smoking, we have hurt a lot of channels in the body with our addictions. So here we are creating a good routine for yourself, so that we cannot go back and get rid of the whatever we have created over the period of time of 30 years of history, but at least we can bring some changes now and follow certain routines which can take you and reduce the effects, the side effects what you have created over the period of time in the physical body. Right? Your mind was always playing both roles, right? Sometimes you used to do this and you will, at the same time, you used to feel like, oh, I'm doing something wrong to myself. So the both things were happening in you at the same time. You were smoking, and at the same time you were thinking also. So your presence was there, but choices, the right and wrong, the good over the bad over the good, but you were awake. But you are not controlled. Mind was controlling you. Okay, now you have an opportunity to control your mind. And that is where we want to bring these changes, these routines in our body, so that you can manage your mind. You can manage your mana. You can manage your psyche. You can manage your whole concept of Manavohastrotas. Okay? So let us do. So here, what you are going to do, I am going to sit in the heel over the heel, which is a Sukhasana. Your back is straight, your shoulders are relaxed, and here in the Kapalabhati Pranayam, we are going to use this fire breath, and when we are creating this fire breath, when we are practicing this fire breath, there is a rapid exhalation included in this technique. So with this rapid exhalation, our aim is to open up the blockages which we have created over the period of time in the respiratory system, in the lungs, in the circulatory channel. And this is where we are going to bring a lot of oxygen in the body, so that it can nourish, it can go, it can reach to our brain. And there are different parts of the brain. We are not going, as I explained you already yesterday's session, we talked about the brain and brain parts and how it works, the types of the brain, the levels of the different parts of the brain. We have already discussed all of that. Here, our focus is to bring the excess amount of prana, oxygen, which can go reach to our skull to detox the toxins, the chemicals from our breathing technique. Okay, so bringing more oxygen, exhaling more toxic levels of the body. Okay, beautiful. Okay, understood? So let's practice this. What you do here, one inhalation and rapid exhalation. One inhalation, rapid exhalation. One inhalation, rapid exhalation. So here, just to start and begin with, I want you to put your palm on your right palm on your abdomen and just practice one with me. Okay, so I will make some noise so that you can hear me, but when you are practicing for yourself, you should not hear. Okay, so inhale here and look at me. Exhale. More exhalations. Okay, so you inhale 1, maybe start with the 10 exhalation, then go to the 15 exhalation, then go to the 100 exhalation, then go to the 500 exhalation, then go to the 1000 in one setting. Okay, so practice on your own. I will show one more time. So you understood the breath concept, the Kapalabhati pranayama. You understood the benefits of it. What is why we are using this for our smoking concept? What is the purpose of doing this? To improve our energy of our lungs and our heart. These two, and heart is related with the mana in Ayurveda, because your mana stays into your heart. That is the house of our mana, mind. Okay, so we are the whole Ayurveda is very beautifully considered all these connections, and that's why Ayurveda is a science. It is an eternal science which is thinking about your physical body, mental body, spiritual body, and emotional body, and not only these aspects, beyond that also in Ayurveda we think. Okay, so oh, that's beautiful. Okay, so here that's a beautiful thing. Okay, so here inhale. I will do one more with you, and then I will give you some time to practice. Then I will take you for the bodywork therapy. We will be doing the Shirodhara and the Marma therapy to focus on our frontal lobe, to focus on our certain points, the Marma vital pressure points, which will help us to balance our mana, balance our mind, and bring the harmony in our mind. Okay, so one more time, you inhale. Here you can sit in the chin mudra and your palm is facing up. When you are doing it, after the while, when you get used to this practice, you just put this in this position outside of the knee. Perfect. Beautiful. Back straight, shoulders relaxed. Beautiful. So, namaste, welcome. This is Dr.Aruna Patki, Doctor of Ayurvedic Medicine, and today's topic was Kapalabhati Pranayama, and I hope you enjoyed our discussion with our client. Why you should do this Kapalabhati Pranayama, what is the purpose of doing this Kapalabhati Pranayama. It's known as a fire breath, and that is the way you are going to bring a lot of oxygen, which will nourish our mind, which will nourish our brain, and which will bring the alkalinity in the body, if you want to understand this on the modern level. But here we are not talking about modern and Ayurvedic. Here we are talking about the concept of pranayama, concept of breathing to improve the quality of life. So stick with us. This is Dr. Aruna Patki, Doctor of Ayurvedic Medicine, bringing the wisdom of Ayurveda, yoga, meditation, breathing techniques, diet, marma therapy, healing therapies, modalities, all of herbs and spices and food concepts to all of you, sharing with all of you, so that you can also start thinking about Ayurvedically, living about Ayurvedically, and living yogically. Thank you. Namaste. So you practice this 10 minutes. One breath in, exhale out. Let it go. Okay? So practice this. I will give you some time and I will prepare your sugar line. Okay, perfect. But you understood the concept? Okay.